A very good morning to you and welcome to today's event, a media partnership with Euractiv and All Policies for a Healthy Europe and the RUMRA Intergroup. RUMRA standing for the health access in rural areas there. We're going to talk about how we can access health in rural areas, remote areas, mountainous areas. We've seen with the European pandemic the situation getting from bad to worse with access to people who are not nearly often enough able to access the services that many of us in cities and towns take for granted. We've seen a great move to digital healthcare and all the opportunities that that offers, but if you've got poor connectivity, you cannot take advantage of it. So we're going to talk about that and the European Commission's long-term vision for rural areas that was published in June. It did acknowledge the difficulties that those sorts of populations are facing, in particular with access to health. There's also questions around ageing population and challenges in leveraging both the green and digital transitions in rural areas. So all of this is going to be discussed today. The event is, as I say, co-organised by All Policies for a Healthy Europe Coalition, which is a multi-stakeholder initiative designed towards putting people's well-being at the centre of all areas of EU policy making. And it brings together a group of NGOs, think tanks, associations, companies and individuals, all with the same aim. RUMRA and Smart Villages Intergroup is about integrated development for European territories in all their diversity and enables exchanges on innovative ways to create vibrant and attractive rural communities and acts as the voice of rural communities to the European Parliament. So thank you all very much. There's a lot to get through. We have some excellent keynote speeches for you to kick things off, and we will then go into a panel discussion. And as always, please don't forget, use the chat function to send us your questions, and I'll put as many of those as I can to the speakers over the next hour or so. With that, I would also remind you that you can tweet about the event or share on social media. Use the hashtag Healthy Europe and the hashtag Rural Vision EU to do so and get many people all around Europe involved in talking about this. And with that, we're going to turn over now to a welcoming message from Vice President of the European Commission, Dubravka Šuica, the Democracy and Demography, and is responsible for the EU long-term vision for rural areas.
Dear honourable members, ladies and gentlemen, it is a pleasure to address this intergroup once again as we address the subject of health access in rural areas. The subject of health remains a priority for this Commission. In the current COVID context, access to health services is more important than ever before. The Commission's recent report on demography points out that 31 million people in the European Union live in a region that faces the twin challenge of rapid population decline and low GDP per capita. Most of these regions are rural. As the title of today's event suggests, a forward-looking approach with a focus on the long term is required. Stronger, connected, resilient, prosperous. These are the four pillars underpinning the long-term vision for rural areas. This vision is developed not only for rural areas, but with rural areas, making sure that nobody is left behind. This participatory approach continues as we implement the actions set out in the vision, like our Rural Pact. This pact brings together all levels of administration and relevant players for making rural areas attractive places to live and work. Next year, we will publish a toolkit on how to make a full use of the opportunities offered by post-2020 EU funds by combining EU funds for projects on revitalization of rural areas. The Vision's Action Plan proposes tangible flagships to sustain remote working and services, mobility, business creation, and innovation in rural areas. In today's world, digital connectivity is as vital an infrastructure as water provision. This is particularly true in the area of health, where e-health services will continue to be further developed. A vision flagship called Rural Digital Futures proposes an integrated set of actions to boost the sustainable digital transformation of rural areas. In addition, a Rural Observatory will be set up within the Commission to further improve data collection and analysis on rural areas. The public consultation of the vision identified health and care services among the most urgent needs of rural areas. As you know, I also work on demography. Demographic change, in particular aging, can be the spark for creating new developments. We must grasp the economic opportunities and the innovative character of the silver economy. I think about innovative technologies, products and services, including in the health sector, that the silver economy is capable of generating. The silver economy is expected to grow by about 5% a year to 5.7 trillion euros in 2025. We know that unmet medical needs are higher in rural areas. In 2019, 3% of the rural population had unmet medical needs. Moreover, compared to cities, towns, and suburban areas, access to healthcare in rural areas has deteriorated over the last decade. At the same time, many rural areas lack young, skilled people, and women tend to leave rural areas more than men. In addition, this lack of skilled young people and women means services provision can be affected. These issues must be addressed. Part of our response is the Vision's flagship on social resilience and women in rural areas. It promotes entrepreneurship for women, participation in decision-making, and investments in work-life balance services. This will be a real boost to making rural areas attractive for women. This will in turn benefit the provision of health services in these areas, because the availability of health services often largely depends on the contribution of women. Successfully addressing all of the issues I just mentioned requires building on the participatory approach of the long-term vision for rural areas. But by saying this, I mean that we must all work together. We need a collaborative approach. The European semester has presented an opportunity to mobilize national efforts to address gaps in access to healthcare in underserved areas. The Commission has often highlighted this challenge, taking into account the variety of problems experienced by Member States. We are providing support through a variety of initiatives. The third health program, the new EU for Health program, and the EU Health Data Space Initiative will bring more opportunities. The Commission is also providing an opportunity to engage on this very important topic of health through the Conference on the Future of Europe. Please continue to raise awareness about the conference. Its multilingual digital platform has more than 20,000 contributions so far. European citizens panels are starting on the 17th of September. Conference plenaries will be starting soon too, end of October. I would like to thank this intergroup and the All Policies for a Healthy Europe Coalition for your collaboration. The spirit of innovation in health services is alive and kicking in our rural areas. I look forward to our continued collaboration and wish you a fruitful discussion. Thank you.
Yes, indeed. Thank you very much to the Commissioner for sending that message and setting out so many of the things that we are going to be talking about today. As she mentioned there's a lot of opportunity to be seized at the moment, so I think it is indeed a very timely discussion. Turning now to one of the partners for this event, we have a short video presentation on the All Policies for a Healthy Europe, just to set the scene so everyone knows what page we're on.
70% of Europeans want to see more action at EU level on health and well-being. Our mission is to position citizens' health and well-being at the centre of EU policy making.
We need to better tie health measures to other linked areas such as the environment, climate, digitalization, food and nutrition, pharmaceuticals, and this will be precisely the focus of our synergies within the Commission.
All Policies for a Healthy Europe is an intersectoral initiative that brings together a diverse group of NGOs, think tanks, associations, companies and individuals. We champion a broad and bold vision for health and well-being and see health and well-being as catalysts to a stronger economic model. We seek opportunities for collaboration beyond the healthcare sector. All Policies for a Healthy Europe is keen to support the European Commission's vision for a healthy, climate-neutral, socially inclusive Europe.
And you can see there at the end of that video that there are indeed several knowledge partners associated with all policies for a healthy Europe. And we're going to hear now with a representative from one of them to give us a keynote speech and highlight some of the challenges we face. That is Ziger Verkouteren, who is the Vice President for Government Affairs and Policy, EMEA, and the Global Supply Chain at Johnson & Johnson. Thank you very much for joining us. I'm going to hand over the floor to you to hear your thoughts and remarks.
Thanks a lot, Jennifer, and thank you and good morning, everybody. It's a real honor and pleasure to be here with you today at this very important event. And I mean, the commissioner really, could she have made a stronger case for what we're going to be discussing today, and to jump straight into the topic of today, hence reflecting about how to improve the health and well-being of European citizens living in rural and remote areas. We need the digital health transformation. Technology is already changing the healthcare ecosystem and accelerating really developments and increasing the possibility of what we can offer patients. And digital tools, on the one hand, empower citizens to manage their own health, but they also allow healthcare workers to treat patients remotely and deliver improved and more equitable health outcomes, while equipping the authorities to accurately track public health through data. Now, COVID-19 pandemic has demonstrated many of the benefits of digital health and has sparked an increasing public demand for efficient tools. And it's not over yet, we're just at the beginning of it. The COVID-19 context accelerated aspects related to technology uptake faster than generally you would see in a healthcare context. By unlocking the power of health data, which we do still too little of, and then apply artificial intelligence on it, we can provide broader access to healthcare knowledge and expertise. We can empower patients to have more control over their health. But what we've probably seen most in these periods is the increase in connectivity between patients, physicians, hospitals, and healthcare systems. It has also allowed to really finally drive more towards personalized healthcare and well-being. Digital tools and medical devices, also the commissioner referred to, also help reduce the variability of patient outcomes and therefore play an important part in delivering health equity and addressing further bottlenecks in capacity we are seeing today. And lastly, but probably most relevant for today's event, it allows to connect remotely located and less favored populations. And just to make sure these two are not always linked, but to give them access to quality services and treatments, including through the accelerated adoption of telehealth, as we have seen during the COVID-19 pandemic. In fact, the rapid adoption of telemedicine during Europe's lockdown helped ensuring at least some relevant continuity of care while keeping patients and healthcare workers safe, and has shown us that really delivering healthcare remotely can result in good health outcomes, a positive patient experience, and lower cost. All elements that before were thrown in as hurdles. Now, the response to the pandemic also increased uptake of omnichannel and induced the shift towards remote interaction, facilitating, in fact, new ways of engagement through the healthcare value chain. We've seen, for example, 40% less in-person meetings in hospitals. We've seen 60% more virtual training of healthcare professionals, which was highly needed. And 53% more patient appointments were using telemedicine and video conferencing. And 30% even surgeons expect remote procedure support. So we at Johnson & Johnson, one of the partners, we believe these changes are here to stay. Whether, for the virtual training of healthcare professionals, patient appointments using telemedicine or video conferences, but also remote case support and many more examples. I think we need to really break out of the mold of thinking how we were delivering healthcare and managing health before with these new opportunities ahead of us. So as a company, we're therefore developing capabilities to support for these remote case supports to help return really the non-COVID delivery of healthcare in hospitals, namely via patient treatment at distance, and surgeon support at distance. But going forward, really, we need to further build on these and to sustain and to improve, but not just to limit ourselves to these areas, as I said before. The potential is far bigger. Healthcare systems now have an opportunity to learn from this experience that was imposed on us and accelerate further healthcare digitization. This is a momentum not to miss. This may include the rollout of remote consultations in appropriate context, as well as the use of digital apps and devices to help patients and healthcare professionals better manage conditions. In many cases, really, these approaches have the potential to not just improve outcomes, but also to ensure patients are empowered and have an opportunity to make their preferences being taken into account for once throughout their payment pathway. However, the digital transformation requires us to work together. As the Commissioner said, together we need to collaborate, and that is to further avoid that health inequalities be exacerbated. At the European Commission, as we heard as well, but they said in a 2020 European Semester Review of Member States' Healthcare Systems report that there is insufficient coordination and cooperation between healthcare providers and a limited integration of health and social care services. We've heard before a lot about silos. Well, they're still there, but we need to get through them. The OECD, and we will hear from them later in the program, recently highlighted that the people most likely to benefit from digital health tools are probably also those who are most likely to face difficulties in accessing them. To build a more resilient and fairer Europe, really citizens should be given the opportunity to reap the full potential of digital health solutions. A successful digital health transformation therefore requires empowering citizens to understand, trust, access, and uptake digital tools and solutions that can significantly improve the quality of health services and citizens' well-being, especially in those remote areas. And so to this end, long-term and people-centered policies are needed, and the EU can have a pivotal role. First, the EU should guarantee that its citizens are equipped with the right digital skills to foster public trust and understanding of digital health tools. What we don't understand, we might be afraid of. And without gaining trust, progress will be very difficult. Policies in this respect should include digital education and communication effort towards citizens to help earn their trust, educate them, and make them aware of the advantages that health data and digital tools can bring to their health and well-being. The focus should not only be on the potential risks of such new technologies, which is a bit of a European treat, but also should focus on their far-reaching potential to improve the lives of all Europeans. Further EU action should also include promote closer collaboration with key healthcare and cross-sectorial stakeholders to develop online learning resources on digital skills and health literacy. Review and transform health and care, the full spectrum, I would say, of professionals' curricula to evolve with the needs and greater knowledge and skills development on digital health. Still, a too rigid approach to the definition of a healthcare professional's role is still applicable today. And we need to help bridge health inequalities through the development of digital tools. So together with the member states, the EU should invest in digital health and disseminate best practices to help citizens, notably Europeans living in remote areas, disadvantaged socioeconomic groups, and elderly citizens to benefit from the digital transformation of health. A successful example is the type of European collaboration is the European Reference Networks projects, through which citizens in rural areas can really access the best experts on rare diseases in Europe. This should also involve a focus on infrastructure and connectivity. There is where it often all starts or fails, as it is important to ensure equal access to broadband across Europe to ensure the availability of such services to all citizens, bridging the urban-rural divide. This issue is not to be underestimated, and for whatever reason, during the COVID period, I've been in contact with people living very remotely in various European countries. you imagine the personal cost to merely bringing a cable or advanced coverage to their homes is outside proportions. Johnson & Johnson and our knowledge partners at the Healthy Europe Coalition are eager to constructively contribute to this transformation. We have all a shared responsibility to our patients, family members, and the loved ones to explore these possibilities and invest in a future where people's well-being is a central priority and disease becomes a thing of the past. Patients are waiting. Thank you for having us, and have a great debate that hopefully will contribute for things to change for the better. Over to you, Jennifer.
Thank you very much for setting out so clearly the issues at stake here, and indeed making reference to a lot of the changes we saw during COVID and maybe how best to leverage those. So I do appreciate, thank you so much for your keynote address. We're going to move on now to the more traditional panel part of our discussion. So a reminder to everyone, please do put your questions in the chat on your screen. If you're following along on YouTube, do remember you can go to the Euractiv page where you will find a way to send your questions as well. And with that, I'd like to introduce you to our panellists. We have joining us today Ana Moreno-Monroy, who is a policy analyst in the Rural Studies section at the OECD. Dr. Stanimir Hazardchev is Secretary General of the EU Patient Access Partnership, PACT. We have Haris Bormidis, President and CEO from Vodafone in Greece. And last but not least, Marianne Eckhard, who is the President of the European Leadership Association for Rural Development. Ladies and gentlemen, thank you so much for being with us. We're going to do a quick 1-minute round of introductions just to hear who you are and why you think today's event is so important. So Anna, let me start with you. I'm afraid, Anna, I think you're on mute. And I'm going to give you a moment to get the mute button switched off. It should be somewhere there at the bottom of your screen. And Stanimir, let me ask you to give us your brief introduction.
Hello, and thank you very much for the invitation. I was listening to the previous two speakers very carefully, and actually I'm happy with what I heard. But besides technology giving us really an opening to us lots of opportunities that we saw during COVID, we also saw that in some places technologies could create even more disparities and difficulties for some patients and some people. Therefore, I do believe that since ancient times, we have been learning a lesson, and I'm not sure we've learned our lesson yet. But all of you know this famous phrase that if the hill will not come to Muhammad, Muhammad will go to the hill. And this is really valid when we talk about rural areas and access to healthcare. On one hand, rural areas have very complex and very complex issue, as we heard, with many different aspects and problems and different population. At the same time, it needs simplification in the way we provide services. So how can we provide a simple solution to a very complex problem? This is one big issue in front of us. The second one is how we make sure that at the end we integrate variety of services, and we don't only cover health, because well-being is not only health. It's social factors, labors, education, and all the other factors that fall into this definition of well-being. So can we provide healthcare in a silo, separate from everything else? And can we say that we have resolved the problem with the rural areas only by providing, let's say, a test or any health services? I would say that it should be definitely in conflict with all others. And on the third place, the co-creation, which was already mentioned, that if we want to go to the mountain, we have to know the mountain. If we want to go to the hill, as Mohammed, we have to know the hill very well. We have to know all the paths there. So we have to talk with the hill, and we have to make sure that we co-create together the solutions that we provide. And last but not least, if we want to be effective in rural areas, besides being simple, integrated, and inclusive to those who live there, we have to provide universal and accessible services for all, regardless of their economic status, their health insurance status, or the country they live, or the health literacy. And with this, I will stop with my first intervention. Hopefully, we will have other opportunities afterwards to continue in details.
Absolutely, we will. Thank you very much. I believe all debates should begin with a Francis Bacon quote, so thank you very much for that. Harris, let me come to you. Obviously, as a representative of Vodafone, you know about the problems with connectivity and the solutions that are out there as well.
Good morning, Jennifer. Good morning, all. I'm really excited about being, part of this conversation today. Also because I had the opportunity to spend 3 years in Sub-Saharan Africa with Vodafone, and I know firsthand what connectivity and health solution can give to rural population or to people with less disposable income. Without any doubt, as we have started to move to, to the digital and to the exponential technology era, it's absolutely critical to understand that the key challenge that we have in front of us is that we should bridge any current or potential digital and technological device between people, between communities, and between geographies. And we all know that next generation access network do play a critical role. Actually, is the enabler. We can do nothing without good connectivity, and especially in the rural areas. Good connectivity and new technologies can create a rejuvenation of the European rural areas, because they will create new jobs, improve agricultural productivity, access to public services, namely also healthcare. But realistically, if we talk about connectivity, next generation access networks in rural, realistically, we need to have in mind that in most of the cases, a fast and massive deployment of those networks in those areas does not make necessarily financial sense in the short run. That's why it's absolutely critical, in my view, that it will be needed significant financial support from the governments in order to go towards this direction. And I believe that the context and the idea and the objectives of resilience and recovery funds, within this context, we can unlock funding to improve connectivity in those areas. But it's not only about funding, it's also about a wider mix of policies that will encourage collaboration in an effort to have more sustainable business models for the companies for a massive and fast deployment of new networks in those areas. And beyond that, I believe what it is needed more than ever is that national governments, together with the industry, in consultation with the industry, to find the right mix of policies in order to rejuvenate rural, in order to make the transition of where we are today to where we want to go, to be such transition to be inclusive and available to all. Now, when it comes to healthcare, there is no doubt. On the contrary, there is strong evidence that good connectivity and e-health applications and solutions can provide better access, better prevention, better diagnosis, better treatment, and better monitoring. Vodafone is very active and very focused on these e-health solutions, and we are proud as Greece that Vodafone has located the Global Research and Development Center in Greece, also capitalizing on our extended experience on telemedicine. As we run a telemedicine program for 14 years now, in Greece that touches about 500,000 people every year in rural Greece. So in a nutshell, I would say that the opportunities in front of us, provided that networks will be there, helped by funding, helped by cross-collaboration between different industries and between the government and the industry, and also because of technology, the technology and the exponential technology of our days, they have no limits. In that way, we can see a more prosperous future, not only on health, but especially on health for everyone across the European footprint.
Thank you very much, Harris, for your thoughts and your expertise, particularly with the view from Greece. Anna, let me come to you now. I think we will be able to hear you. Give us your comments, please.
Yes, thank you, Jen, and good morning, everyone. Thank you for the invitation. I'm an economist at the Center for Entrepreneurship, SMEs, Regions, and Cities at the OECD. We've been looking at the problem of improving access to healthcare in rural and remote areas through the lens of balancing basically three dimensions: cost, access, and quality. And we see that policies often have focused on the cost and quality dimensions, but not necessarily on the access. And actually, these kind of policies, efficiency-driven policies, can hurt access. And this has been a disregarded area that we are calling for to bring forward again. Here, we identified too that in OECD countries and in Europe, there are long-standing rural-urban gaps in all three dimensions. So rural areas are behind in all dimensions to start with. And we give a series of recommendations that go along the lines of taking a people-centered approach, especially reinforcing primary care and leveraging innovations, especially, as was mentioned before, the huge potential of telemedicine, and last but not least, ensuring the retention and attraction of health workers to rural areas. So I hope during this event, I will be able to discuss some of this more with you at length.
Thank you, Anna, for that and for that slide as well, leaving us a very clear idea of some of the big problems and the big challenges we need to address. Marion, give us your perspective. You're from the Association for Leadership for Rural Development, something that I think it sounds like we do need at the moment.
Thank you. Thank you very much first for inviting me, and thank you also for organizing this event, because I think it is indeed really, really important. And I'm also so honored to be speaking here with all these experts because I'm the president of the European Leader Association for Rural Development, which means that we gather more than 2,200 local action groups from 28 different countries. So it means that I think I'm here because I'm the voice of the rural people here today. And when I think about what difficulties the policy and decision makers could encounter when designing solutions to improve health access in rural areas, well, I think it is true, and digitization is very important, and it can help for regular visits. I think you call it primary care. But today, at least as I have understood it, it's not for more serious illnesses or intensive help. I am from Sweden myself, and we have come, I think, very far when it comes to digitalized care. There is a lot of activities going on, and it's normal that you do all your appointments via the same homepage and so on. But this does unfortunately not help the women in northern Sweden that have to travel 400 kilometers to give birth, or 400 kilometers only to make a regular ultrasound. And in rural areas more adjacent to cities like my own, I only have to drive 50 kilometers to give birth, or for any acute emergency, which is pretty far still. I have been in situations where I have been driving a screaming child for 50 kilometers. It takes almost an hour. And I think it's very stressful and dangerous. And I do not really know how digitization can help us in those situations. And also, we need to know our first aid. because if there is a potential mortal emergency, which has not happened to me yet, thank God, we can wait 20 to 30 minutes for the next ambulance to be there. So we are definitely depending on car and driving license and real care. On the other hand, I think it's positive that the digitization is proceeding, which means that in any not so acute issue, I can meet doctors online, I can prescribe medicine. Unfortunately, in Sweden, the net doctors have shown to be targeting young and healthy people. That means that they have a contrary idea to the regular health care, where our regular health care is working to give the most needy persons help first. The private net doctors are actually targeting the most prosperous, which means that they are kind of draining the system with cases like urinary tract infection or other simple diseases, where a Swedish patient in the regular system would normally only meet a nurse. Those private doctors, private net doctors, let the people meet a real doctor, and then it is the regular system that has to pay for this doctor appointment. So it turns that the private providers actually has the result of the regular care getting scarcer. But strangely enough, it has shown also that the people that are using the net doctors are most young and healthy people living in our bigger urban areas like Stockholm, Gothenburg, or Malmö. In Stockholm, they use the net doctor 4 times more often as in Norrbotten, one of our northernmost regions. So, and another problem with the digital healthcare is that there is prescription of psychopharmacies going on, and there is no follow-up. And I guess we all know that this is not good, because people need maybe more ongoing help than that. However, I mean, the system comes up from something, and I have seen also articles from doctors that work for the net doctors that think that the regular care system is too slow, too administrative, and that is why we need private solutions like this. So what we need, and what is really important, I think, is for politicians and administrators to carefully examine and react on what consequences the system that you're building up digitally has for the taxpayers. In Sweden, I think we're not clear around it yet, even though the majority of the voices seems to be claiming that the system that is being built up from private providers is draining it. The patients still use it because it's much more accessible. So in the end, I think in Sweden's case, it's a question about how much tax income and costs we do have in each region, because in our country, the regions are responsible for the healthcare, and this is very different from region to region, and we need to make systems that provides the basis for an equal healthcare also for people living in rural areas. So I mean, I think, yes, I'm not an expert, so I think there is probably a lot of ways to develop digital healthcare, what you can use it for. But right now, the reality that I see in Sweden, at least, it is mainly for young, healthy people in urban areas. Also failing skills or failing connectivity, of course, like some of our experts said before, leads also to unequal healthcare. And we should be aware of the system with private initiative competing with the regular public healthcare. Also, I would like to point out that we have unequal health situation out of course, income, education, gender, but also I would like us to look more at the place where you live, because I think that rural people are losing out on what is being offered and how can we do it. And I think the scarcity, of course, makes it hard to make economies of scale, but people in rural areas, they pay taxes as well, and we have a responsibility if we don't want people to feel left behind. So I think, yes, there is a possibility for digitization to solve some issues, and probably for this primary care maybe, but we need to develop much more than we have in Sweden right now, for example. Thank you.
Thank you very much. Indeed, you're echoing there, I think, what Stanimir said about how we need to prevent digitization actually increasing disparity, something that's important. But also, Marian, I'm very struck by your image of driving 50 kilometers with a screaming child. That's a very real feeling that I think we can all tangibly relate to. And also, I thank you as well for bringing up the issue of it being territories that maybe deal with these areas, because of course health is not an EU competency, it's a member state competency. So actually trying to bring all these threads together is quite challenging. So now we've met all our panellists who are going to be having a debate and a discussion about all these issues that we've set out in our opening comments. We're going to turn now to a keynote from MEP Tomislav Sokol, who is the Vice Chair of the Rumra and Smart Villages Intergroup and the All Policies for a Healthy Europe Coalition Wellbeing Ambassador, who's going to set out a keynote that we will then be able to draw on during our panel discussion. So thank you very much, Tomislav. Over to you.
Thank you very much. I'm very glad and proud to be part of this event, because this is directly relates to the topics that I've been discussing here and making initiatives on here in the Parliament since the start of my term in office. I apologize maybe for not being here from the start because I had some technical issues, but I'm glad that it has been resolved now. So, access to healthcare. I think that is one of the most important problems now in the European Union, because we know that European Health Union has become the topic in this term in office due to a large extent to COVID-19 pandemic, but also to other initiatives like the European Beating Cancer Plan and other initiatives related to healthcare, which have shown us that even though healthcare is, as you put it, primary competence of the member state, EU is there to provide added value. So to resolve those issues, those problems which member states cannot resolve by themselves. And I think here, this is the key role that EU can play, especially COVID-19, but also, as I said, the initiative of EU Beating Cancer Plan have shown us that EU can really make a difference and can really help to address the issue of unequal access to healthcare. Because without unequal access to healthcare, with such big differences in terms of access to healthcare, which then translate to health outcomes like mortality for some as a result of some diseases, but also average life expectancy. So all of these differences that exist, while they exist, we cannot really speak about equality in European Union. We cannot speak about fairness, about solidarity, and we also cannot speak obviously about European Health Union, but also European social citizenship as a concept. So we know that we have the European citizenship, we have the European pillar of social rights, but without having equal access to this basic public service, and that is healthcare provision, we really cannot speak about all citizens being equal in the European Union. And this is I think this is one of the crucial issues that the European Union has to address now. Of course, this inequality of access can relate to different groups, minority groups in society, different parts of the European Union, like for instance, usually the bigger problems are in the east than the west, but the problem in rural areas is probably the biggest. And if you look at all the benchmarks and all the criteria, etc., you can see that really the problem of healthcare access is the biggest in rural areas, which amount to the majority of the territory of the European Union. And of course, without having access to modern infrastructure, to modern public services like healthcare, we will have people still emigrating, people still leaving the rural areas. We'll have the demographic crisis getting worse and worse, which is also one of the big issues in the European Union. So this is definitely one of the problems that we have to tackle. Because if we do not do nothing, or if we do not do enough, people from rural areas will continue to emigrate to cities. These areas will be left empty or with very elderly population, and in the end they will just die out and they will just be left empty, which will be a big major political issue, economic issue, demographic issue, but also security issue in some areas of the EU if they are left empty without population. And of course, so this why I think this is a very, very timely topic and very timely discussion. I think two biggest problems that exist when we discuss healthcare access in rural areas is the lack of basic health infrastructure, like hospitals, like primary care medical facilities, etc., but also lack of healthcare professionals. So I know from my country, for instance, that that it's very hard to get healthcare professionals, even if you pay them higher salaries, to actually go and work in rural areas, because living conditions are different. They have to usually cover very big areas of space. They do not have access to modern equipment, which they can use to facilitate actual healthcare provision. They do not have access to data, to digital infrastructure, which is in many cases very useful for healthcare professionals who provide healthcare. So this is definitely, so these are all problems that need to address. But health infrastructure and lack of health workforce, these are, I think, the two of the crucial issues that exist in rural areas. So then, after identifying the problem, and they have also been mentioned by previous speakers, the question is what European Union can do about it. Because in many cases, when we discuss problems and solutions, we mix up competencies and powers of the member states, their possibilities, their programs, plans, actions, etc., and those of the European Union. So what can the European Union do about it? And despite the fact that in many cases we use this division of competences as an excuse not to do enough on European level, I believe that now these excuses can no longer work. With the announcement by the President of the Commission of the European Health Union, that we should really focus on all of the instruments, all the possibilities that we have at our disposals to make a difference. And I usually group these possibilities into two types. So we have the regulatory possibilities and we have concrete financial possibilities, which are now bigger than ever. When you speak of regulatory, there are many legal parts of legal framework, regulations and directives that either are already in place, need to be reworked or improved, but also some additional new pieces of legislation that is being worked on now, which will make a difference once adopted by the Parliament and the Council. But of course, first proposed by the Commission. One of the initiatives that has already been mentioned is health data space. So this is I think probably the most important current regulatory initiative in the area of healthcare, because it resolves problem of using data across different member states. Because we know that data is key. We know European reference networks, which are used for cross-border healthcare collaboration between different healthcare professionals and institutions, are being used to big extent. This is the actual success story of the European Union. But we can also see that when using data in different member states, we are facing issues, and the main issues relate to interoperability. So we have different protocols, different technical ways of using data. We have unfortunately, different interpretations of the GDPR requirements in different member states, and all of this is making the use of data very hard and very complicated in these administrative and bureaucratic terms. So if we want to have this real cross-border cooperation, the use of data, use of digital technologies, use of e-health, for instance, then we need the regulation of European health data space, which will make this health data interoperable, that it can be used in different member states. This sounds maybe a bit abstract, but we have some very concrete practical examples. Let's say that you are a patient from a border region, from a village in a border region, where your closest healthcare institution, the closest place of healthcare provider is just across the border in the different member state. So what the use of data and digital technologies and e-health offer you is a chance that you do not have to go physically 50 kilometers to hospital, for instance, in another member state or in your own member state, but you or your primary care physician can just send your data, your information on your medical condition to a specialist in this hospital in a different member state, and then get the important specialist opinion on this. But if you want to do this, then if you want to send this data across border and get the medical opinion of specialists from other member states, then we need comparability of data, then we need interoperability of this data, and this is what the idea of European health data space will make, so that your data can be used by specialists in other member states, that you can get their opinion, and without having to travel 50 kilometers or 100 kilometers, which is a big problem in rural areas, especially for patients who are elderly, who may be physically unfit or unable to travel, they do not have means of transport, etc. So this is one of important initiatives. So I know that the Commission is working on this proposal now, and I believe that next year we'll already be in progress of adopting this legislation also in the European Parliament. The second big issue, the second big instrument that we can use to improve access to healthcare in rural areas is cross-border healthcare. So we know that we already have cross-border healthcare directive, which regulates this, but we also know that these possibilities to access healthcare in other member states, in case adequate healthcare cannot be provided in your own national territory, is very problematic, very complex, very cumbersome. So problem is, of course, geographic distances. You have to travel long distances, differences in language between different member states, obviously, problem of lack of information, lack of possibilities to travel, but also big administrative and bureaucratic obstacles to accessing healthcare abroad. So first, it's essentially these obstacles are very big. For instance, first, it's not just the cross-border healthcare directive which regulates this right, but also social security coordination regulations, possibilities to access healthcare abroad. And they have different rules, different procedures prescribed, different tariffs of reimbursing the actual amount, the actual cost of healthcare, and different procedures that are used. And so this is so complicated that only healthcare specialists and legal specialists who deal with these specific topics, such as myself, for instance, are actually know how to actually use these rights which are provided by European Union legislation. But that's the problem. So, and still large obstacles exist. Additional obstacles exist. One of the biggest obstacles is that, according to cross-border healthcare directive, patients who want to access healthcare abroad, which cannot access at home, they have to pay upfront. They have to pay the actual cost of the treatment and ask for reimbursement, which, of course, for people with less resources from rural areas, it will be a big problem. And also one of the big issues is that the people who decide about whether adequate healthcare can or cannot be provided in your own member state are usually those specialists who are providing healthcare in your own territory. And in many cases, we know many cases that they actually prefer to say that their own treatments that they are provided by themselves are bigger and are better and more efficient than treatments provided abroad. So this is why I have proposed, and I am glad that my political group, the European People's Party, has accepted this in the BECA committee, the Special Committee on Beating Cancer. So we proposed several amendments on the report on the European Beating Cancer Plan, with the idea to make this cross-border healthcare much more accessible and much more visible, and to provide much more information for the patients about possibilities that they have. So the first proposal is actually, since we have two sets of these reimbursement rules on coverage of costs of healthcare abroad, the Social Security Coordination and Cross-Border Healthcare Directive, the idea is to merge these rules into one. So to make them much more simple, make much more transparent, and in this way, the patients will have much bigger knowledge, and it will be much easier for them, much less complex for them to know what their rights are and to use these rights to access healthcare. So that's one thing. The second important proposal is the right to second opinion. So if the doctors in your own home country tell that you have adequate treatment which can be provided in your own territory, the idea is that you can ask for second opinion from other members, from physicians from other member states, who will say whether also good treatment or better treatment can be provided in that other country. And the idea is to impose an obligation on member states to provide much more information about these possibilities to patients that exist now. And final point about funding. So, and then I will be finished. European Union has a lot of possibilities to invest into health workforce and health infrastructure. We have EU for Health program, which is 12 times bigger than it was, that a similar program was in the previous financial period. But we also have the cohesion policy. And the cohesion policy, which is not usually mentioned in this context, is the biggest source of funding for health infrastructure provided by the EU. In the previous 7 years, because I'm working as a rapporteur in the Committee on Regional Development on this topic, actually 56 billion euros were provided from EU funds, from cohesion policy funds for investment into health infrastructure. And this can be used to invest into digital infrastructure, into actual hospitals, into actual healthcare facilities, into transport, infrastructure, which is necessary if you want to access healthcare professionals if you're in rural areas. But also European Social Fund can also be used to finance, for instance, subspecializations for healthcare professionals in rural areas. So to have more healthcare professionals actually providing healthcare in those rural areas, which is a big problem today. So to sum up, healthcare inequalities, lack of equal access in healthcare, one of the major issues. We cannot speak about European Union as a union of equal citizens with such a big problem. Rural areas, the biggest challenge, the biggest problem. We have regulatory solutions like the new health data space regulation, which will provide interoperability and make use of the exchange and use of data across borders. The revision of cross-border healthcare legal framework, and also a lot of EU funding that can be used for health to improve health infrastructure and health workforce for access to health in rural areas. So we have a lot of things at our disposal. We have to start working not today but yesterday. Thank you very much.
Thank you very much. It's very comprehensive indeed. And we were getting comments in from our chat function remarking on many of the things you've said there. One person is suggesting that instead of transporting patients across borders, maybe we need to work on transporting and the cross-border mobility of health and healthcare professionals, which is, I think, a good idea. Something I'm sure we will be able to pick up in the rest of our panel. So thank you very much, Tomislav, for joining us today. I'm going to turn now back to our panel discussion to pick up on some of the issues raised there by our MEP in his keynote. In particular, we talked about he mentioned the issue of cost and funding as a central point. So Anna, let me start with you. On your slide, we saw that there might be trade-offs between quality, cost and access. Could you reflect on where maybe those balances lie?
Sure. Jen, here I think it's important to realize that a lot of cost-efficient strategies, for instance, centralizing care in a city, may improve quality because you have professionals that are attracted to cities that will work in the hospitals, and this will result in better care, in better quality outcomes. But at the same time, decentralization, that can also result in cost efficiency because you have scale economies. It's affecting access. So then you have to wonder about the cost of the populations that cannot directly access these bigger facilities. And here is where we talked about reinforcing primary care and how you go about it and how you complement it with telemedicine. But I think a very important point I want to make at this stage is that a lot of the urban gaps that we saw in the slide along the 3 dimensions are driven strongly by a compositional effect. The fact that you have a higher concentration of lower income, lower educated people in rural areas compared to urban areas. And we know that these populations have worse health outcomes that are related to them accessing less often medical services, that accessing less preventing services, for instance. Then also the part on aging that is extremely important here. In rural populations, you can have a higher share of the elderly that spend the last years of their life in poor quality of health, and this increases cost, let's say, exponentially. That's when you see really the cost of healthcare exploding. It's at the last part of life, how you spend those last years. And here we don't have very good data to assess the rural-urban gaps in this dimension that is extremely linked to raising costs in healthcare. We know, for instance, that 80% of women in Latvia and Slovak Republic spend the last years of their life in poor health, 80%. We don't know how many of these live in rural areas, but we might guess that a lot of them live in rural areas. So how do we take care of these gaps that are related to both incomes and aging that are more present in rural areas, given that these are structural factors? Because as I mentioned, this depends on the composition between rural and urban areas that we don't see will be changing in the near future.
Thank you very much, Anna. Stanimir, I want to come to you next because I'm seeing some of the questions I have ready for you are actually being echoed already by members of the public following along today. So clearly we're touching the right nerve today. So Gefra Fulane has asked, she said, digital solutions certainly enable better access to healthcare and other services, but how exactly can we counter the challenges that rural regions present, given that each case in each region has its own specificities? So I think, yeah, I mean, you mentioned a lot about the digital telemedicine opportunities. What do we really need to fully leverage the potential?
Well, two things I think we have to consider. On one hand, we heard from Mr. Sokol that we have lots of opportunities in Europe to invest in digitalization and in rural areas. This is fine, but are we sure that always the investment is done wisely and that the investment at the end is is fulfilling its purpose to increase access? I have the feeling that in Europe we are too much putting efforts in innovating and reinventing the wheel every time with every new project, and governments have this tendency to do it rather than taking those models that really work and simply implement it. And I think Europe has a key role here. Besides healthcare being a competence of governments, I think Europe has the responsibility to make sure that the European money are used only for those solutions that the evidences show that they work. So this is one really important thing, to make sure that the technologies are accessible and that they would fit the purpose we want to. The second very important thing about this is about the simplicity of the technology. I think the best technology we can have is that technology that doesn't require any health literacy from the person who interacts with it. It should be created in a very natural way. So somebody who has never touched a computer, a telephone, or anything technological would be able to interact through a natural way, let's say through voices. Therefore, I do believe that in future, in rural areas, technologies which are really close to the people, developed, co-created with the people, would dramatically change the situation. Technologies that stay at home and interact with the people every day, rather than waiting to a year or several months to go to the doctor, they will really do the real change. And technologies which will allow people to live where they are, and but still have high quality of healthcare services, and not only health, but social and the entire spectrum of services that they need. These are the technologies that would change the situation right now, and I think we should look into those. Actually, lots of them already exist. The only thing we have to do is to wisely use the money that EU is providing, and to make sure that they really go for the benefit of the rural areas and the people living there.
Thank you very much for that. I want to come now, Marion, to you. We've got quite some interesting questions coming in from our audience, so we really appreciate that. Do keep them coming.
Yes, there are probably, we should look for a healthy life, and I think we can have it also in rural areas, but I'm sure we can have it in urban areas as well. So I'm not sure that is actually what we should be aiming at. I think also people are dreaming of this rural areas where people are not suffering from stress, but I think people suffer from stress everywhere. It's like a global disease right now. So I'm not sure. I think it's a little bit of a romanticized picture, but I don't have a data and statistic around it. But I know that there are people that want to live in rural areas, and they should be able to do so without risking their lives. And that is my main point, I guess. And also I wanted to add, and I think what the digitization, the main gain could be actually, because I see that in the digitization, and I was really impressed from Stanimir saying that we should not put all the effort in innovating, but to use the systems that we have. And we should put in these systems and connect them to the regular healthcare, so that we can maybe save money in the regular healthcare, and then have the possibility also to go out and give real healthcare, in real life healthcare to people, because I think that is missing, and it will be missing also in the future, unless we come on get better economically systems running. Thank you.
Thank you. Yes, indeed. Some of your comments also being echoed in the chat function that we have. People saying that we need to attract more doctors, make the rural areas attractive to the healthcare professionals, and others suggesting ways to try and rejuvenate these rural areas. I'm going to come back to you in a bit, Marion. I want to ask you about strategies. But first, let me turn, Harris, to you. Marion there mentioned stress as a global disease. We have already got a very serious pandemic on our hands. How do you think the COVID-19 pandemic has altered the rollout of digital, the uptake of digital and telemedicine services?
Yeah, definitely. The pandemic was a digital acceleration across the board. We had an organic shift to digital, but the pandemic acted as an accelerator, and I think it made evident to everybody where we should be getting to going forward. I think when it comes to help and reflecting to very right challenge coming from Marion previously, which basically says how far we can go. So my reflection to that is I'm much more, I think the focus on the restrictive factor, if we will not be able to have good connectivity, new generation access network in rural areas, that would be the restrictive factor, and not what the technology can possibly do. And I think we have a number of examples. As it was said previously, the technology is here, and we have a number of examples that I can share with you very briefly. So first, given, as I said before, the 15 years of, almost 15 years of telemedicine program we run in Greece, we have hard data indicating, for example, that 75% of the people reported a reduction in the number of hospital visits. 1 out of the 2 said that the primary care was improved. 90% of the doctors reported that it's the important benefit of telemedicine, for example, was the ability to deliver better quality of service. And of course, the decongestion of regional hospital was evident as well. But this is the baseline. And as we're moving forward, we can take this to the next level. We are not too far by using 5G technology from having remote surgery in place. The prototypes are there. We need to, to fine tune, but I don't see it's going to be many years to the time that we will see remote surgeries. In Germany, another example by Vodafone in cooperation with University Clinics of Düsseldorf, created a 5G private network combining this with other technologies like augmented reality, virtual reality, and then having applications regarding precision medicine, remote health monitoring, remote consultation and treatment, and many other cases in Portugal, in Spain that we have implemented. In a nutshell, I think inevitably we should take this remote health provision to the next level. The technology is there, and as we speak now, the technology is improving across the board. The benefits of remote healthcare are already evident. We need to make sure that we're going to have the networks in those areas, because all the technology I mentioned before will not work without 5G, without good connectivity, fiber. So this is something that we should care more about, because the rest, it's here, as said, but technology will not stop.
Thank you very much for that and giving us the technical side of it. I'm seeing some comments in the chat. Mark Roberts from County Fermanagh in Northern Ireland wants to see an enforced focus on outcomes over the medium term and the long term rather than process. We also have more questions about how can rural areas become more attractive and offer the same in terms of healthcare as is found in urban areas. I'm going to put this question now to Anna and Stanimir from Vasiliki Anugurdi, asking about what sort of healthcare we should be looking at. Balanced healthcare services that address both chronic and primary care and acute needs. So I want you to perhaps, Anna, reflect on the different sorts of healthcare, and maybe come on as well and talk about maybe prevention as well as treatment. But is it, do you see one area or another that is more in need of upgrading?
Yeah, this is an excellent question, because it relates to this balance that we've been talking about. Actually, the provision at higher levels above primary care requires higher scale. So this is why we see a concentration of these more specialized services in space. And we know a lot of Europe will be losing population, becoming more sparsely populated. So it will be not cost efficient to have those facilities everywhere. On top of that, it will be difficult to attract professionals that would have to travel long distance to get to work in these facilities. So it is maybe not a viable option to have acute and specialized care everywhere. That's why we emphasize the important role of primary care, especially on prevention, and as a door towards these more specialized services that can become of higher quality once they're concentrated. So it needs to be a strong link between the physical provision of primary care with the higher levels, especially because in a recent report that we did, we look at the population projections to 2035, and we see that the needs for different services, such as maternity services or cardiology services, will change a lot as the population ages and as fertility rates keep declining. So we have to keep in mind that population trends of different age groups will affect strongly, in some cases, the demand for certain services. So we need to plan from today, how are we going to serve populations in the future, and what makes most sense to organize these acute and specialized services in space, so you maximize access and quality, and also seek cost efficiency.
Some really great points. I'm sure, Stanimir, you will echo many of those, but I'd like to get your thoughts on what sort of services are needed most urgently, but then also to take, as Anna did, looking to the future about whether it's about preventative medicine or chronic ongoing care.
I think that any service might be most needed when you need it, personally. So for each patient, this service that is needed right now is the most needed one. Therefore, we cannot prioritize in a way that we reduce some services or put them away just to prioritize others. Appropriateness, this is one of the words that explains access according to the 5 A's concept, is exactly that: to have the right service at the right place for the right patient, nothing more or nothing less. So what is the best model actually to provide such services? This is a question that we are questioning ourselves as well. And that's why currently we have an open call for the packed model access solution. So I would encourage everyone who is listening to us or watching us right now, if you are aware of a model somewhere, regardless whether it's in Europe or beyond, please do apply and do put forward this project. It will be reviewed by really experts, high-level experts, to see if we have such models can be implemented on place. Being honest, I've seen one such model. Unfortunately, not in Europe, but of course, not everything is happening here or starting here. But the best model I have seen is a model where the people, the citizens, can access healthcare facilities which are integrated with all other services. In one single day, they can receive all the services, not only the healthcare services, but the labor one, and each patient is evaluated in this single day since he's contacted, and once in this multifunctional center, he receives everything he might need. On top of that, they are very well linked with the bigger healthcare facilities like hospitals and doctors from different specialities have the opportunity to look and to provide high quality advices and services to the patient at the place where he lives. And only those small proportion of patients who really need are fast transported to the bigger center. And actually in such cheap and big in numbers facilities, we can afford to have actually healthcare in every single city one day in Europe, if not in every village. But this is the way forward, I do believe, using the technologies and optimizing existing resources and stepping on the evidences, providing accessible and high quality care to all, without losing time and without spending more time for the patients to go from doctor to doctor or waiting times. It has to be accessible and fast for everyone. And
Thank you very much. Let me come back to you, Tomislav. I think you wanted to have a brief comment on what you're hearing.
Yes, thank you very much. So I wanted to comment on this discussion about provision of healthcare for patients while staying in rural areas versus them going somewhere else to get healthcare. So I think that, of course, the priority is to make it possible for them to obtain healthcare without having to travel somewhere. And this is where EU can make a difference. So I mentioned funding from European social funds for health workforce, which will then be who will stay and provide healthcare in rural areas. And we can use EU funding, European Cohesion Policy Social Fund, to actually provide incentives for medical doctors, for health workforce to stay in those rural areas and to go there and provide healthcare there. Also, when we speak of investments, of course, we are mentioning digital infrastructure, digital services, e-health, telemedicine, etc. But if we want to have this possible in rural areas, then we have to provide digital infrastructure. Because in many rural areas, in Europe, you just do not have high-speed internet, so you cannot use these services. And this is also where European Regional Development Fund can be used to finance this basic digital infrastructure, which can then be used to get healthcare services in rural areas without having to travel somewhere else. So this is obviously the priority. But apart from that, there are some cases where you need to go somewhere else to get healthcare. If you need a very complex surgery, in most cases you will have to go somewhere else to get healthcare. So the idea is, with the revision of healthcare, cross-border healthcare rules, is to facilitate and make this provision of healthcare, if it cannot be provided in your own territory, in your own rural area, in your own village or somewhere, then that you can access this healthcare somewhere else, maybe in another member state, without all the bureaucratic and administrative hurdles and obstacles that you have to face. So, of course, priority for EU funding for regulatory framework for provision of healthcare for people while staying in rural areas, but also to make it possible when there is no other way to go somewhere else and get healthcare.
Thank you, Tomislav. Thank you for following so intently our discussions today. We're appreciative of it. I want to come around now. We're in our last 10 minutes of today's event. So I want to have a final round of questions to the panel, because we haven't really dealt with some of the policy points that we could have maybe raised in terms of what is the European Commission doing. It outlined its initiative to address rural areas earlier this year. So I'd like to ask you all, what are the difficulties and the challenges that these policymakers and design of our future policy face when looking to improve health access in rural areas? And what is your dream access? What is your dream level of access to this? What would your particularly best policy for rural healthcare in 2030 or say 2050 look like? So if each of you can give me your idea on what that would look like and what you would like to ask these policymakers to do. Harris, let me do it in reverse order this time. Harris, let me start with you and give us your final thoughts to take away.
Now, I think the vision of the Commission and what it has been outlined in the context of resilience and recovery funds are on the right direction. We saw from the previous speaker from Tomislav that there is in the agenda is at the very high level of how we make sure that digital infrastructure is in place in those areas in order to take advantage of the technology. I believe that not at the European level, but I think on a national level, I think resilience and recovery funds should have a vision of enhancing, of working with the industry and enhancing the investments, as I said at my introductory comment, in order to make sure that rural areas will not left behind, and then we will eventually increase the digital divide between urban and rural. For me, this is the critical parameter on how we work together with national governments and the European Commission in making digital connectivity in rural areas a reality now and not in 10 years from now.
Thank you, Harris.
Thank you.
Yes, indeed. I think a timely call to action. Marion, I'm sure you have thoughts as well on this, on where strategy needs to go and what your big ask would be.
Yes, thank you. I think I said it already before. I also appreciate the long-term vision on rural areas, and I think that we need also to make stronger decisions from policymakers. But then it would be, of course, on local and regional and national level, how the digital healthcare is supposed to be complementary to the regular healthcare, and how it all can add up to be some kind of economies of scale, because the digital healthcare can for sure help with that. Because I think it is not the problem of the digitization, it is the problem of the economy and how we manage the system. I think that would be a great way to go, and I was really impressed again from Sunny Nir and this model he explained about. This would be the best way to go, I think, to find models that use all the possibilities, but in an economically sound way, so it makes sense. And yes, my main point is all the time the same. Rural people always also pay taxes, and it is really important to see too that they don't feel left behind, and that's it.
Thank you, Marion. I think I have some little glitch here, but I think I caught the gist of everything you were saying. Let me turn, Stanimir, to your thoughts on what needs to happen next in terms of policy to deliver your utopian vision, as it were.
Well, luckily, I don't think it's very utopian, because I've seen it on practice and how people can benefit of that. We only need to learn from those who already have implemented it. But what I believe is really crucial in the years to come, and this is something as a major learning from the COVID, I think, that we have to really stop being excusing ourselves with these competency issues, and because I believe that besides the very nice strategy, and this is not the first one that's coming from the European Commission, at the end, the weak part of the entire process are member states, regions, as previously mentioned, who might decide or wrongly understand exactly what the strategy is for, or because of lack of expertise or knowledge or political will, at the end the strategy to be just a good, nice piece of paper without any effect and implementation for the people who need it. So I think Europe has a role from now on, a responsibility, because we saw that the COVID doesn't respect any national competencies. It simply goes everywhere. It's the same with many other diseases which are not so visible as the COVID issue, which simply ran out for a few days through entire Europe. But diseases are like that, and if we have patients or citizens of Europe in some areas which are neglected or don't have access to technologies or to proper healthcare, this is not the problem of this region alone. It's our common problem, because we live in one economy, because we are all responsible for this economy, because we cannot afford to have countries that are on second speed, third speed, or lagging behind, because we cannot afford even a single life to be lost due to preventable or treatable disease. Therefore, I think this would be the greatest challenge ahead. The member states really to decide and to start working together towards better healthcare systems. And the health union is a good step towards that. But this is really utopic for me. But I do believe that even the most brave utopists might start becoming reality if we all think alike. It's clear that healthcare cannot stay like it is right now, fragmented, different, inaccessible, and creating issues for member states themselves and for the entire union. We have to work together in more unified way, so we make sure that we have equal access to same quality healthcare based on evidences.
Thank you very much. I think you've done a great job there of actually summing up a lot of what we've been saying. So Anna, I will turn to you then to have the final word on this question regarding your report looked at a lot of this. So give me sort of come full circle, if you like, to tell me what it is you think is needed from policy side.
Yes, I think the most important area right now is to move away from spatially blind policies towards a more place-based approach. And for this, we need to change the mentality that healthcare policies are done only by the Ministry of Health. It's really the problems that we face require multi-actor, multi-sectoral strategies, a lot of dialogue and more flexibility. It cannot just be top-down approaches like it has been. We have to break these sectoral silos, and we have to advance in the question of rural proofing, really having a rural lens when we design policies, for instance, related to efficiency. Besides this, I think what I mentioned, taking a forward-looking approach also on this, it's important. So those two things, multi-sector, multi-actor strategies, and taking a forward-looking view, this, as I said, is a question of governance and requires really bringing actors together and changing mentalities.
Thank you very much indeed, Anna. And of course, we have posted the link to that OECD report in our chat function. I want to sum up. I will also say that we have had many audience members appreciating very much your input from all panelists. But in particular, thank you to the OECD for emphasising the role of primary care, retaining health professionals such as community pharmacists in rural areas, and expanding the scope of services they provide is a key lesson to learn from COVID-19 for EU health systems, says Antonio Grasso. So thank you, Antonio, for those comments. Thank you to all of you for your questions. Unfortunately, with an area and a topic as vast as this, we didn't have a chance to get to all of them in just 1 hour and a half. But I do appreciate that there's a lot going on in the chat and a lot going on online in terms of keeping this conversation going. Obviously, this is not the end of this. This is a step forward in the journey we need to take towards getting better healthcare rolled out across the EU, wherever you are. But thank you very much for joining us today. Thank you to all our speakers. Do stay with us, follow along Euractiv and see our upcoming events, and have a great day.